is Cassidy Linty. I'm going to be doing the modified NOTS test for my online clinical pathology 2 class, course number 2331. I'm going to start with my formalin. I did off-camera solution between the formalin 110. I did 2 mils of this. I did 10 mils of the sterile saline to make a 2% formalin. So I'm going to take this, and I need 9 mils. So I'm going to take this syringe and measure 9 mils. So I have 9 mils of my formalin. I'm going to go ahead and close this. And here I have my centrifuge tube that I'm going to open and put the 9 mils in. Replace the lid for now. Here is my blood sample from a dog that we are testing for heartworms. I'm just going to invert it a couple times just to make sure it's mixed. And then here I have another syringe, and I'm going to take 1 mil of the blood. Alright, now I'm going to go ahead and put the blood in with the formalin. I'm going to go ahead and invert that. I'm going to throw away the syringe. Alright, so now I'm going to go over here and I'm going to put this in our centrifuge. Put it right here. And I'm going to start a timer for 5 minutes, and we're going to centrifuge this at 1500 RPMs. I'm going to go ahead and start that. And now we're going to wait for the 5 minutes. We'll come back after 5 minutes and we'll finish the test. Alright, we're back for the video for the modified NOTS test. We have 3 seconds left on the timer. It did just go off, so I'm going to go ahead and turn off our centrifuge. I'm going to let it slow down. I have a hemostat here that I'm going to use to get the tube out. Help it slow a little bit. Alright, I'm going to reach in and take this out. Alright, here we're going to have our separated sample. We have our supernatant at the top and our sediment at the bottom. So what I'm going to do now is I'm going to go over to our sink and I'm going to pour out the supernatant. Alright, so now I'm going to add 1 to 2 drops of this new methylene blue blood stain. Put this back up. I'm going to do it here over the sink. We have 1 drop, 2 drops. I'm going to close this, and now we're going to mix this sample with a pipette. Mix it thoroughly until it is very well mixed. Alright, so now I'm going to take a sample from the bottom of the tube. Okay. I'm going to place this here. I'm going to put the lid back on here and move this back over to our holder. Now I have our microscope slide. I'm going to put 1 drop over here in this corner. I'm going to put another drop over here. And I'm doing this so I can get a good representation of the blood sample. Now I'm going to take two microscope cover slips. I'm going to put them on both of my drops. Alright, now this slide is ready to be evaluated, so I'm going to go over here to our microscope and I'm going to put this on. And we're going to be using the 10 times magnification and the 40 times, but we'll start at the 10. Okay. So now I'm going to be looking for any of the microfilaria parasites. I'm just going to focus my scope. Okay. Alright, and for this slide, I do see a microfilaria worm, or heartworm, and that is because this dog is positive for heartworms. Since I did find it on the first slide, I'm not going to examine the second one. I'm going to be doing a fecal flotation for this video. For my supplies, I have the fecal matter from a patient, which is a dog. I have a microscope cover glass, a microscope slide, Fecosol, my fecal medium, and my fecalizer sample cup. So for this, I'm going to take a wooden applicator to help me. I'm going to take the sample and just kind of squish it in. Make sure I get enough. Remove the excess. Put this to the side. Then I'm going to go ahead and stick this in here. And I'm going to take my Fecosol and I'm going to fill just a little bit to the bottom so that way I can take it out and mix it. Alright, now I'm going to lock it down into place. I'm going to fill it the rest of the way to form a meniscus at the top. Now I'm going to take the microscope cover glass and I'm going to place it on top. Normally I would wait 10 to 15 minutes for this. For the purpose of this video, I'm going to go ahead and take it off and put it on my microscope slide. And now the slide is ready to be evaluated under the microscope at 40 times magnification. This test is used to look for parasite ova. It's different from the other tests that we would do for fecals by looking for ova versus normal bacteria that we would see, that we would use for the higher magnifications. You can confirm with the 10 times magnification for any ova that we would see. For this video, I'm going to be doing a fecal smear. My supplies is going to be sterile saline, which I already have drawn up into this syringe, a microscope cover glass, the microscope slide, a wooden applicator, and the fecal sample. So first I'm going to take a drop of the sterile saline. I'm going to put it on the slide. Then I'm going to take the wooden applicator and I'm going to put it in the sample, and I'm just going to move it around so that way I have a good representation of my sample. And then I'm going to put it in the saline. It helps to lift it up. And I'm going to mix it around. And I'm just going to use the other end of the applicator to mix it and smear it. I am going to take this large piece of fecal matter out. And then I'm going to take the microscope cover glass. I'm going to place it on top. This slide is now ready to be evaluated under the microscope, which what I would use for that is going to be the 40 times magnification. This test is used for looking for live bacteria, any kind of protozoans. Alright, for this video I'm going to be doing a fecal float with a centrifuge. So I have my fecal cup here and my fecal sample. I'm going to take some out and put into the bottom portion. Here I have my fecosol. Put some in the bottom so I can mix it up really well. Okay, I'm going to take this wooden applicator and take some of it out. Okay. So I'm going to put this to the side. Okay. I'm going to mix it up just a little more. I'm going to fill this to the top with my fecosol. Okay, now I'm going to use a gauze sponge to strain it into my centrifuge tube. And I'm going to fill until there's a small space at the top. Alright, and now I'm going to put it in my centrifuge 5 minutes. For the purpose of this video, I'm going to cut now and come back when the centrifuge is done spinning. Alright, so my timer has 5 seconds left on it, so when it goes off, I'm going to start my centrifuge. Slow down a bit. And then I'm going to take my forceps, take out my sample. Alright, so now I'm going to place it in my wrap. I'm going to fill the rest of the way up with Ficusol to make a meniscus at the top. Okay, then I'm going to put a microscope cover glass on it. Normally we would let this sit for 15 to 30 minutes, but for this video I'm going to go ahead and take it off and put it on my microscope slide. Now this slide will be ready to be evaluated under the microscope. The fecal flotation with the centrifuge is used to find the heavier parasite ova, and we would view it at 10 times magnification. My name is Cassidy Linty. I'm going to be doing the fecal sedimentation for my Clinical Pathology 2 class, course 2331. I'm going to start with my stool sample, and I'm going to weigh out 2 grams of stool. And that is 2 grams. Alright, now I'm going to mix it with some tap water. Now I'm going to use a gauze sponge to strain it into my centrifuge tube. To fill it most of the way to the top, leaving a small space. Just gonna go ahead and dry the outside. Alright, and now I'm going to put it in my centrifuge for about 5 minutes. For the purpose of this video, I'm going to cut off now and I'll be back in 5 minutes. Alright, so I have my timer here at 5 seconds. So when it goes off, I'm going to stop my centrifuge. Okay. Just gonna help it slow down just a little bit. Okay, I'm going to take my forceps, take my sample out. Alright, now I'm going to see it. Okay, now I'm going to pour the supernatant off into the sink without disturbing the sediment at the bottom. I'm going to take a pipette and take from the top layer a small amount going to put droplet on my microscope slide. Alright, and I'm going to take a microscope cover glass and place it on top. Now the slide is ready to be evaluated on a microscope. Fecal sedimentation is used primarily for large animals and for the larger parasite ova, for example, the fluke parasite. And now the slide is ready to be evaluated. For this video, I'm going to be doing a free catch, and we're going to be collecting mid-sample. He had already started to urinate before we were ready, so I'm just going to collect some samples. We collect mid-sample because that reduces the chances for contamination. Morning samples are always the best because they are more concentrated. We like to do free catch because it is easier and more convenient for clients if they need to bring in a urine sample. So I was able to get his a little before we were ready, but I still got it midstream. It is a little cloudy, has a bit of an odor to it. It's pretty normal odor, smells like dog urine. It is a light yellow, medium yellow. I would go more to say light yellow. So now if we wanted to, we could take this in and transfer it to a better sample cup so we can do a UA. All I used for this was a clean, dry container and then my collection stick. So other than that, we have the urine free catch, our voided sample collection process. My name is Cassidy Linty. I'm going to be doing a video today on a cystocentesis. I have my patient here that is sedated. We can show that it is a live patient. So it is good. Alright, we do have the patient in dorsal recumbency for this video. There's 3 different methods that can be used for cystocentesis, and that's a blind stick, and that's when you just estimate where you think the wire would be and put in. There's also palpation isolation where you would feel for the bladder with your hand, hold the bladder, and then poke in, stabilize the bladder with your hand. There's also an ultrasounded guided cystocentesis where you would use the ultrasound to locate the bladder and then use that to guide your needle in. For this video, I'm just going to be doing the palpation and isolation. So I have my patient here and I'm just going to feel around the area this would be, and I do feel it pretty well right here. So I'm going to put some alcohol to prep my site. And I do have a clean needle and a syringe. So using my hand to stabilize, I'm going to poke down about halfway with my needle. When that's done, then I'm going to draw back on my urine. And if you move the video over here so we can see the urine coming in, because I don't want to move my other hand because it's stabilizing the bladder. Okay, now that I've got a pretty decent amount of sample, I'm going to remove the needle, put the cap back on. I'm going to change to a new needle before putting it into a clean, sterile tube. And I'm doing this because it reduces the chance of contamination from the outside skin, fur, any dirt that may be there, so we can get a better UA when we run this. Yeah. My name is Cassidy. I'm going to be doing a video today on a urinary catheter. I'm going to be placing it on Tyson. I'm going to start with my gloves. They are sterile gloves. So I'm going to open these. Be careful not to touch. So I'm going to take my non-sterile hand and put on the outside of this cup so I can pull it on. Now I'm going to take my sterile hand and put on the inside. So I can place my other hand in. Okay. So now I can adjust to pull this down. Okay. So I have a sterile filled drape over here already for the purpose of this video. I'm going to be using a sterile catheter and a sterile syringe and sterile lube. So I am going to be using a red rubber catheter. I'm going to dip the tip into my sterile lube. Since my fingers are sterile, I can go ahead and rub this down just a little bit. Ideally for this patient, we would be using a larger or a longer catheter. This is what we have. Dr. Schultz is going to clean my area here. We do have a sterile drape over him to keep the fur out of getting in the way. Okay, so now I'm going to go over here. I'm going to start feeding.
The length.
We measured with this from this end the tip of his penis and around like this. So I'm going to measure. So, so I'm just going to add a little more lube.
Push your drape over the...
Alright, there we go. So I'm just going to keep feeding. Okay, I'm just going to keep feeding. Alright, now I'm going to go ahead and place my sterile syringe. Negative pressure. Keep going a little more. Some more negative pressure. Alright. take a couple mils. I'm going to keep this and I'm going to discard the first few mils. I'm going to put this back on. Okay, now I'm going to get my sample. Okay. Now this can be ready for a UA, and I can go ahead and take out my catheter. Okay, we do use 3 different types of catheters, but this would be the red rubber. We do have another kind of Foley, which we use for if it's going to stay in for long term, and then our other is polypropylene, and that one's just if it's more to be more sensitive for the patient. For this video, I'm going to be doing an ear cyto. We do ear cytos in patients that are presenting with symptoms such as shaking the head, scratching the ears, an odor coming from the ears, or any redness in the ear. We're going to be taking a sample from both ears. We're going to be looking for bacteria, yeast, any signs of infection. So I have Cassie here in my restrainer. I'm going to go from the left ear. I'm going to take an ear swab, just roll it around to get a good sample. And I have a slide with her name and that it's the left ear on it. I'm just going to smudge some of the sample on. Okay, now I'm going to do the same thing with the right side with a clean swab. Alright, some to put on my right slide. Okay, so now I'm going to take my slides over to my sink. I'm going to use matches to heat fix them. Alright, now I'm going to start staining my right ear sample in a right stain or right stip stain. I'm going to start with the first one. We're going to leave that in there for 10 seconds. Ready. Okay. Just going to clean this black off of the back of the slide. This is my left sample. Just going to dip it. Going to move it over to my number 2 in my stain for another 10 seconds and start the stain on my left ear sample. Okay, now I can move this over to my 3rd stain, and I'm going to leave that for 20 seconds. This is ready to move over to my 2nd stain. Okay, I can go ahead and take this out now. Put this in for 10 seconds. I'm going to take distilled water and clean off the stain. Okay, I'm going to use the candle. This slide is ready to be viewed. Go ahead and do the same with my left ear sample. both ready. So now I'm going to go over here. I'm going to start on 4 times magnification. Turn my light on so I can focus on what I'm seeing. Okay, when I have a good focus, I'm going to move over to my next, which is 10. Alright, and now I'm going to move over to the next. Okay, now when I go to my last one, my last magnification, I'm going to add some immersion oil to the slide, just a drop. And I'm going to move it this way so I can focus in to see any bacteria. Okay, so I am seeing quite a bit of yeast just on this first slide. As I keep moving around the sample, I'm still seeing quite a bit of yeast. I'm not seeing much of anything else. There's a piece of fur. Alright, so for Cassie's right ear, there is definitely yeast present. So then what I would normally do is I just do the same thing with her left ear, going back to 4 times magnification and focusing. And then just moving up magnifications whenever I focus. Okay. For the left ear, just going around, I am still seeing yeast, not quite as much as in the right ear. Some fur epithelial cells. So for this particular patient, I would say both ears have a fairly amount of yeast, probably about 2 to 3 plus. This video I'm going to be doing a skin scraping on a dog. I'm going to be doing a deep scraping and a superficial. So for this I need my immersion oil, my microscope slide, a number 10 blade microscope cover slip, and a microscope. So first I'm going to put some immersion oil on my slide, and then I'm going to put some on my blade, and I'm going to use just a plain part of this patient's skin because he doesn't have any lesions, but if I was doing this on another patient who had lesions, then I would locate a lesion and scrape towards the outside of the lesion, because that's where the most activity will be. For a deep scraping, I would just squeeze the skin. Then I would scrape with the fur. Keep it tight. Okay. Alright. And then I would come over here, scrape it off into my side. Okay. And then if I was going to get this ready to view, put a microscope cover slip over it. And what I'm looking for is any kind of mites, Demodex or let me just get this set up. Okay, I'm seeing bits of his fur, some debris, but for this patient, I'm not seeing any mites.